Welcome to City and State TV. I'm Morgan Pechma. Today, our guest is the chair of the New York State Assembly Committee on Health, and he is also the longest-serving Assembly member in the history of the chamber. Dick Gottfried, thank you so much for joining us on City and State TV.
Happy to be with you.
So you have been traveling around the state promoting a bill. Can you talk to us about that bill?
Yeah, we're holding 6 public hearings around the state. It's called the New York Health Act. It would create a universal health care system, universal health coverage for every New Yorker. You know, the Affordable Care Act has made some very important improvements, but its fundamental flaw is that it leaves us in the hands of insurance companies. And so New Yorkers continue to struggle with rising premiums, really out-of-sight co-payments and even more out-of-sight deductibles, more restricted provider networks than ever, plans that have no out-of-network benefit. And as a result, people, and we've been hearing this at our hearings, are either going without care and often suffering devastating health consequences, or if they struggle to pay for the care out of pocket, it devastates their family finances. More and more employers are shifting more of the cost of health care to workers or dropping health coverage entirely. It's a drag on job growth in New York. The New York Health Act would provide totally comprehensive coverage to every New Yorker. Instead of being funded by essentially regressive taxes that we now pay to insurance companies that bear no relation to ability to pay, it would be funded fairly by broad-based assessments that would be based on ability to pay. I think it's clear that New York really can do better, and you know, as a state, as a community, as a family, I think we have an obligation to do better.
Well, single-payer healthcare is a dream, particularly of many liberals. But do you really think that this has a chance of passing, or is this a symbolic fight that you are waging?
Well, I'd be a really wealthy person if I had $1 for every person who says to me, well, of course, everyone knows single payer is the only sensible thing to do, but it could never happen. We've got to get all of those folks to say out loud and together, it's the only sensible thing to do, and to forget about the notion of whether it can ever happen. Because if people who believe that it's the right thing to do and who believe that every New Yorker should have an equal opportunity to health and to family financial stability, got together and said that out loud, it would be, I think, an unstoppable tide.
Well, I think it's pretty clear that, particularly as long as the Republicans are in control of the state Senate, that this bill could never pass both chambers of the legislature. But do you think that it can come to the floor of the Assembly for a vote?
Well, first of all, I think you're probably right about the Republican majority in the Senate. They very rarely do anything contrary to what the insurance industry asks them to do. I am very hopeful we will get it to the Assembly floor this spring. If it does, it will pass overwhelmingly. A large part of the purpose of these hearings and a lot of other efforts we're going to be doing is to demonstrate that there really is very broad statewide support for this, and that colleagues of mine who come from more conservative districts than mine, and almost everyone does come from a more conservative district than mine, will understand that this is not only something they can vote for safely, but that it will be strongly supported by their constituents.
You know, my colleague Ashley Hupful was covering one of the forums that you've been holding around the state. She said that the response was largely favorable, but she also was pointing out that there seems to be a lot of union support for this bill. Can you talk about that?
Yeah, there's been a real surge in union support for it. The state AFL-CIO, the New York State United Teachers, 1199, the New York State Nurses Association, which actually was in favor of universal health coverage and helped to recruit me years ago to the issue. The Retail Wholesale Department Store Union, the United Food Commercial Workers, the Communication Workers of America, the UAW. The list goes on and on, the machinists. I don't want to leave anybody out and offend them. The reason there are a couple of reasons why there is this surge in labor support. Number one, unions are having to devote almost all of their collective bargaining effort in a rearguard action to try to defend the union negotiated health benefits, as that becomes harder and harder to do. And they're understanding that this blocks them from bargaining for anything else for their workers. Second of all, under the Affordable Care Act, more and more employers are saying, I'm going to pull out of the union plan and send the workers to the exchange. And so a lot of unions are not happy about that. Unions that have good health plans that they've negotiated understand that in a couple of years under the Affordable Care Act, they will be devastated by the so-called Cadillac tax aimed at so-called Cadillac health benefits, which really means any health plan that's pretty good will be hit with a very devastating tax from Washington that will make it almost impossible to maintain a good health plan without jacking up the cost enormously.
And taking, if we had a single payer system, that would take healthcare off the table in union negotiations, right? Would that fundamentally change the way that labor relations work in New York State?
Exactly. Just like no union has to spend a lot of time negotiating whether the employer is going to pay to send your kid to public school or pay to help the fire department come if your house catches fire, unions will no longer have to be bargaining with the employer over your health coverage. It will be paid for whether you are the multi-million-dollar CEO or the lowest paid worker in the company. Your health coverage will be paid for by these broad-based assessments based on both payroll and non-payroll income like capital gains and dividends that will be broad-based and based on ability to pay.
You know, a person who was familiar with the Safe Staffing for Quality Care Act said that there was a possibility that you might attach your single payer bill to that one in order to build union support. Is there any validity to that?
No. I mean, I am the sponsor of both bills in the Assembly. I think they're both important pieces of legislation. Nobody has suggested that either bill would benefit by being glued to the other. They both have a pretty uphill road.
Do you get a sense?
By the way, the one sort of connection between that was that one of the upstate unions that represents healthcare workers was pointing out that a big obstacle to having enough nurses at the bedside at the hospital where she works is the enormous amount of money the hospital has to spend on staff to argue with insurance companies. And her point was that if they didn't have to spend so much on administrative staff to argue with insurance company administrative staff, both of which, by the way, we pay for through our premiums, the hospital would have a lot more money to put nurses at the bedside of patients when they need one.
Yeah, you were talking about, kind of barnstorming with this bill, going into different cities, that you're enabling your upstate colleagues to see that there is not just support downstate for this idea of a single payer bill. Have you spoken with the speaker on where he would stand on bringing a bill like this to this bill to the floor?
I have, and Speaker Silver said very clearly on the merits he supports the bill. His concern is that he wants to, on behalf of my Democratic colleagues in the Assembly. I mean, this isn't him thinking; it's him thinking on behalf of, what he hears from the rest of us. He wants to make sure that it's not a vote that's going to get a lot of our colleagues in trouble politically. And so, he said several months ago, why don't you go around the state holding hearings, show you've got the support, show the kind of backing the bill has, then we can talk. So here we are.
Well, oftentimes the legislature passes one House bills that we know that will never pass, the entire legislature. Let's say this bill does get to the floor.
But then they do. And one of the wonderful things about the legislature that sort of strengthens my addiction to the process is that things that you think you could never get done, sometimes the stars align and lo and behold it happens. I put in the first same-sex marriage bill in 2003 in the Assembly. I don't think anybody imagined that just 8 years later the governor would be signing it into law. with Dean Skelos as the majority leader of the Senate. But that's what happened.
Or your medical marijuana bill as well.
Well, the medical marijuana bill took a little longer than the same-sex marriage bill. But yeah, until fairly close to when it passed, a lot of people said, yes, the strong majority of the public supports it, but you'll never get that to the floor of the Senate. Well, we did.
Is there a political advantage as well if this bill were to make it to the floor of the Assembly and to pass? I mean, could that be leverage in the next electoral cycle?
Well, I think if New York voters come to understand that universal health coverage really is on the public's agenda and is not just some fanciful idea, I think, yes, it does then become a very powerful campaign issue.
Lastly, we were just talking about medical marijuana. There seems to be a rising tide across the country for the legalization of recreational marijuana. Mm-hmm. Do you think that there is any chance that that can gain traction in New York State?
I think there will come a point where that will happen. I don't think we're there yet. There are bills in the Assembly and Senate to do that. I think not an overwhelming, but a small majority of New Yorkers think that makes perfect sense. But politically, I think that idea is going to mature for a while.
Richard Gottfried, thank you so much for joining us on City and State TV.
Happy to be here.